Okay, so Dr. Steve's going to go first, and then I'm going to finish it off, okay? And we're going to aim really hard at getting you out of here in an hour or less.
Yep. Oh, good.
Yep.
We can do that. But
Okay.
we want to share what we know that can be done.
Yeah.
Because inflammatory is huge. My research tells me that the arthritises, osteo and rheumatoid, there's 100 different types. And then these inflammatory, the autoimmune, the guts, the body attacking itself, there's 80 of those, right? And so there's the problem with inflammation is not it turning on, because it's supposed to be there. It's supposed to help us recover from traumas or protect our bodies. That's what it's there for. The problem is that it gets the switch turned on and it doesn't get turned off. That's what we need to do, is to get it to turn off. So things that are physical, I'm going to more of the physical, she's going to do more of, I call it the biochemical, the way that our chemistry works in our body, right? So that's what we're going to work on tonight. Every disease process starts with inflammation. There isn't anyone out there that doesn't. So when it starts, we need to let it do its normal course. Now, in a trauma, physical trauma, there is the inflammatory. In the inflammatory, you put the ice on it, right? Mm-hmm. Okay, you elevate, you constrict, you do those type of things, but that should last anywhere from a couple of days to a couple of weeks. The next phase is repair, and repair is, you know, when you got the cut, the cells that are damaged have to get rid of, the ones have to mend on there, okay? That's called repair, and repair takes anywhere from 2 to 6 weeks to do, okay? And then after that's remodel. Now remodel is for the flexibility and strength, and so that's why it needs a little bit longer. It needs about 10 weeks to take and do some things to get that tissue back to being strong and able to go, okay? So there's acute and there's chronic inflammatory. Acute is when it's the first time and kind of happening. Chronic is when these timelines, it's going past that. The switch is still on. Why is the switch still on? Oh, that's what we have to look at. So we have to look at the causes first, right? There could be, the first thing I talked about is the traumas, right? And that's the strain sprains, where, gosh, I did something that was too heavy and I pulled a muscle, right? Pulled is a strain. If it's with a muscle, it's called a strain. If it's with a ligament, then it's called a sprain, right? Strains heal quicker than sprains on there. But we got to look to see what the cause is. If it's an acute injury, that's pretty okay. Let's not do that thing again, right? Let's not fall. Let's not lift something that's too heavy on there. But when it comes to repetitive, we're doing jobs and things that are doing a lot on there, right? And so if we keep with doing that, it's going to eventually add up. The thing about being young, 20, we can do that, right? Okay. As we go through our decades, we can't quite do that. So the arthritis starts to show up in as our decades go along with repetitive. So we have to watch to see, is there things that we can change and do? Well, then let's do that. Let's change that up, right? If it's in an imbalance where you're doing something but you're doing it all the same side, you're going to take and imbalance. And the body likes level and plumb, right? I always talk about that, right? Level and plumb. And that's what we try to get after. Plus, we can move with flexibility, right? If we have that, it's going to do well. So if it's a weakness or atrophy, then we have to strengthen. So we got to kind of look at the cause. We got to see, okay, what is the physical cause on here, right? But some of the symptoms that we can have is the obvious joint pain. Right? That somebody, when I get out of the chair, oh my gosh, it's right there, right? Okay. Along with pain though, because some people are like, well, it's not really painful. Well, than an achy pain, right? Achy's like, oh my gosh, this is just, it's a chronic, it's been a long time, right? I hear that from people, right? So we have to rehab from there. What about stiffness? Stiffness is arthritis, okay? And stiffness can be arthritis can be one or more joints. It doesn't have to be the whole body and everything's inflamed, but it can be, right? But it can be just one. I got somebody with an ankle deal in there, okay? And then it goes to their knee, and then it goes to their hip, and then it goes a little back, right? It kind of spreads a bit on here, right? So it could be pain, joint pain, it could be stiffness, right? It can be tendonitis, where the muscle's tight and it's pulling on the tendon, then you have pain at some people have the inner joint. Yeah, it's right there, yeah, exactly. Well, that's osteoarthritis. And you can do things about that. About throbbing. Anybody have throbbing pain? That's not a usual one, but it can be part of that. How about loss of range of motion? Okay, we're not in pain, right? We're not in the symptom on there, but I just can't move like I'm supposed to. Well, that will get into circulation problems. Circulation problems are what can take and lead into more inflammatory. Some of the other obvious is like when the joint is warm to the touch on there, right? And we got to take and try to ice it, calm it down in there, right? So those are some of the symptoms that we have of the physical signs on there, right? So let's see if it's in the joints. The things that chiropractors look at is it moving, right? And in the spine or the joints on there, we get in there and we start to move the joint and flex it. Palpation, right? The reason that we do that is because the joint is supposed to have a spring in it. So I'm looking to see, is it springing, right? Take your finger, see participation, right? Take your finger and bend it all the way back, okay? That's your active, right? Passive is that you can move past that, right? That, like that, okay? See the spring in there? Joint's doing good, right? It's functioning. But when I go in and I palpate the spine, there's areas that I find that's like, ooh, hey, I didn't know that was so tender. Right, your body, your mind has this reticular activating system that can filter out non-important information. If it's achy, it's going to take and go, it's not important, right? If it's really got and I can't get out, ooh, now it's not going to let me kind of put it in the background, put it on simmer, right? Okay, so we get in there and palpate the spine. We're looking for malfunction, dysfunction on there. You feel it as, ooh, I can feel that, right? We adjust it and we get motion and position. The nervous system travels at 500 miles an hour. So once we adjust it, go back and I check it, right? And you go, oh, hey, that's better, right? Okay, now we got this thing flexing. We got it moving. We're going to circulate. The body goes, okay, now we're going to get better on there, right? So we look at the spine for position and motion. And then if there is problems where it's a weakness, one of the things I look at is to strengthen the core, right? Everybody knows core is king. In your situation, core is queen. And so what we have to do is we have to work on our core. People I start with is abdominal bracing, and then we go into doing some sitting stabilizations, then we go into some ball exercises, then we get into the bands, okay? And weight-bearing exercises is what's supposed to be done. Right? You go to your doctor and he tells you, oh, get some more exercise and watch your diet. But what does that mean? Right? Okay. Right? That's what the recommendation is, but how do you do that? That's what we're trying to do here, is to give you more information and show you how to do that. So, strengthen the core, abdominal bracing, sitting, and then the ball work and the bands on there. Stretching. We have to work on stretching. If it's like the tendonitis, that they're too tight, I think that we are using our bodies a lot but we're not coming back and working and stretching and getting our body flexible and balanced on there. So that's why I recommend the stretching on there. On my video, there is stretching that I do because I teach it all the time. I got tired of pushing play and keep showing people. So it was great. I took a video of it and I put it up on the line on there. And you can do full body, you can do cervical, thoracic, or low back on there, right? Whichever one you need on there. Go to the video, go watch that. You can replay it and how did that done on there, right? Because sometimes you see it and a physical therapist shows you it and you go, how was that done? How can I do that? So I found the videos to be good. So the 6 stretches in the 3 planes, and we should be stretching 1 time per day. With whatever we're doing, we should keep our flexibility going, right? And nutritionally, okay, so nutritionally there's some things that I try to do here. Yeah. All right. So Ligaplex 1 and the Ligaplex 2. Now Ligaplex 1 is used for the acute injury. That's the one that's a strained sprain on there. It's going to help you through that. Now if it turns over to where it's been there for a long time and my tissues are needing some help to strengthen up, that's called Ligaplex 2. And what it is, it's a special formula. It's 5 different nutritionals put together so that it helps the tissue to heal on it. Everybody's heard of glucosamine, right? Has glucosamine, but it has other put together in a special formula on there for the disc on there, okay? Ligaplex is more tissue, soft tissue. This is more for the disc to heal up.
This also has boswellia in it, and boswellia is a natural ibuprofen. And so this has an built-in anti-inflammatory that will not cause harm to the liver at all.
What is the name of that one, doctor?
Glucosamine Synergy.
Oh, okay.
Okay.
Yeah, very popular product for us.
And then the
All right.
and then omegas, omega-3s, omega-6s, right? Your good oils, 9s, right? Okay. We want to take and use on when we make things. We want to use butter. I mean, that's good stuff, right? Coconut oil, olive oil. You want to use
avocado
those
oil.
type of oils because in your body there is type 1, 2, and 3 prostaglandins, right? And that the oils do 2 of those, and so they keep the inflammatory down naturally, right?
Prostaglandin 1 and 3 are anti-inflammatory. Prostaglandin 2s are inflammatory. So anytime like you hit your finger and it swells up, that's prostaglandin 2 doing its job. It's supposed to, right? Now as the swelling goes down, that's prostaglandin 1 and 3 doing their job to go in and eat inflammation, right? So if we're in a chronic state of inflammation, we need to make sure we're getting good oils to help assist in the anti-inflammatory response.
To shut that switch off, right?
So what is that oil called, that one?
Well, this one's the tuna omega-3,
You've been on that one.
right? And the wheat germ oil,
Right.
right? There's
Linum B6, which is,
Cataplex F.
yeah, Cataplex F, Linum B6, those are from the flax families, right? And we also have cod liver oil. We use a lot of cod liver oil. That's a huge,
That's the one I'm
yeah,
on.
that's a huge anti-inflammatory. You bet. And
Yeah.
great for the skin. Makes pretty skin.
And then another thing we found is trace minerals. Trace minerals in our food, the way it's being grown right now, the mineralization isn't there. Oh, wow. Wow, that's a big problem. And so,
Here's an example of the importance of minerals. Without proper minerals, we get improper brain function, which causes things like depression, anxiety, AIDS and bipolar, and other things that make us not think correct and make correct decisions.
degenerative processes of the brain.
Yeah. So, thinking of an incident that happened last week in Oregon, makes us not think correctly when we don't have minerals firing in the body.
So we know minerals are needed, and so what's great about this is you take
5 drops.
15 drops in water, and you're supposed to be drinking your water, right? Okay, so that now you can get that. You don't have to.
Take a pill.
You're not going to get it from the fruit as much as what we should and what we think of.
Right.
So those are the things that I suggest in the nutritional. Turmeric.
Turmeric,
Yeah,
and-
that's a great anti-inflammatory. That's an herbal.
That's this one right here.
See, yeah.
Turmero. And it has this one has 420 milligrams of turmeric in it, and it's in a liquid. So people who have digestive issues, it allows them to uptake it faster, to help relieve pain faster. But great for the heart as well.
Well, you can eat a lot of curry. Hello.
And there's, I try to get my clients to use as much food as possible to assist them in healing. But there's a lot of people that they just don't cook like that, they don't eat like that, so we need to take it in a supplement form.
I was reading the other day, if you don't mind me, that turmeric is one of the greatest preventatives for Alzheimer's. You know, if you eat enough turmeric, you're not going to probably get Alzheimer's.
Yes, it is. It's fantastic. I love turmeric. We are using it a lot in people with multiple sclerosis as well. It works very, very nicely. So,
physically, we want to take and have our bodies move well. We want to eat well, and we want to think well. So hopefully what I shared with you so far on there, give you some ideas and help you out in keeping these bodies functionally for a lifetime. So we're going to take and have Lex talk about the autoimmune now, because I think that is, once you understand it, it's kind of like, oh, wow.
Yeah.
And we can do something about that?
I can. So what studies have found is that inflammation actually starts in the gut. 80% starts in the gut. And what we didn't know back then and that we do know now is that if we have a improper digestive system, then the chances of you heading into disease processes are really high. So people say, oh, I just need more Maalox, I need more Tums, I need more Pepsin, or Pepsid, or Pepsid-AC, there it is. Those are your first indicators we've got an improper digestive system going on. Having a bowel movement every other day, a couple times a week, that tells you, oh, something else is going wrong. Because you should have a bowel movement between 1 and 3 times a day. And the reason is, when we have babies, they nurse, they poop. Every time they eat, they poop, right? And then we become conditioned as we get older that, we're in school, I'm not going to go to the bathroom in the school, so I wait until I get home. And so then they learn to hold it, and those sensors get shut down. And there's times that we had a little boy, they couldn't remember the last time he had had a bowel movement.
Mm-hmm.
And he had to think, and he says, well, and this was like April, it was at Christmas time, Mommy.
Oh,
But the
what?
parents didn't know, right? So we're talking systemic issues for this little guy because he was misbehaving in school, had improper impulse control, could not think straight, brain fog, everything. He was all over the place. Well, when you have fecal matter that is just building up and building up and building up in the gut, you're going to have one very sick individual. In this case, it was a little boy.
So that's not usual. How about what happens with people?
Yeah. So this is where the inflammatory response occurs. Once we get this type of impact in the gut, we start seeing where problems start building up. So what I'm going to hand you first, before I go into that, have you take one and go ahead and pass that around. So my clients get the digestive lecture right from the very beginnings because it's the foundation of what I'm doing. But when we're looking at the gut, there's a whole bunch of areas where we can start seeing issues. So the first thing that can happen is in the stomach. And like I said, you're needing digestive aids where all of a sudden we're getting acid reflux, heartburn, indigestion, etc. people will start taking acid blockers, but what happens is those blockers stop you from absorbing, okay? Which means you're not absorbing calcium, so it's not going into the bone. You're not absorbing vitamin D, you're not absorbing iron, you're not absorbing your B vitamins because they have to be attached to acid in order to be driven into the system. So if you block the acid production, you then block the ability to absorb, okay? Because that's what they're designed to do, is stop acid production, okay?
So this sphincter right here stays shut until your pH gets down to 1.5 to 3.
A normal acidic level, like he just said, is 1.5 to 3, but for some of you, what does that mean? Water's at a base of 7, okay? Total alkaline is at 14, so that shows you how hot your stomach acid is. When you're digesting, we don't want you drinking a lot of water when you're eating because you're going to increase you're going to dilute your pH. The other thing that happens is if you're drinking ice water, well, that makes everything cold and it stops the digestive processes. So if you are going to drink with a meal, it needs to be at room temperature or warm, right? And a big help is adding some lime or lemon. Add a little acid to it, some apple cider vinegar, so that when you're eating, we're actually breaking those proteins down. So your next stop is, we get this thing called H. pylori, and that inflammatory response gets all around this valve or this valve right up here, and that's a infection that you actually have to have medications for. But this is also the beginning of where what's called SIBO, small intestinal bowel overgrowth, starts right in through here, because now our food is not broken down properly, so it's not making it into the rest of the digestive tract like it's supposed to. So we get improper broken down food here that's in larger chunks than it should be, and it makes its way into the intestinal tract. And what you can see is called leaky gut, that one in the center. We now have leaky gut because we have taken an intestinal tract that cannot break down large chunks of food. We have it in our minds, if I chew it enough, then it will get down and my digestive system will do the rest. It doesn't work that way. Absolutely doesn't work that way. So when it gets down here into larger particles, and what many times, and many of my clients have, is diverticulitis, okay? Those larger chunks don't know where to go. And so they get stuck, and it gets down in here, and it starts wearing holes into the intestinal tract, and then food gets caught up in those holes, which can rupture. And that's where we're in hyperbaric chambers and trying to save a person's life. The other side of it is, in this small intestine, we have villi. We've all heard about the villi, the little fingers that move food nutrients through. They're supposed to be in tight junction, and what happens is, as we're going through the digestive processes, if food's not broken down properly, those junctions can break apart. If they break apart, that allows food particles, pesticides, chemicals, and everything else to get into our bloodstream. We are now attacking ourselves, and this is where autoimmunity comes in. This is where the inflammatory response comes in. Once those chemicals start going into the body has its weak points, right? Whether it's set up through your genetics or you have areas of injury. You can be in a car accident, could have been a gymnast and messed up your knees or whatever. Somewhere along life there's usually some area of weakness in the body. That will be the first point that inflammation is going to attack. So it can, as you can see in the picture, the joints, that's severe arthritis. You can see colons and intestinal tracts, which is a normal one and an abnormal one. So when you're looking at that top picture, you can see that nice pink colon. Well, that's great absorption. You can see everything is going to go through that. But you look at a colon where it's all red and inflamed like that, you're not absorbing. You're not absorbing any nutrients. So how does your body have defense mechanisms to go in and fight the inflammatory response if your gut looks like that? What I tell my clients is, you're not born with a zipper. You can't open this baby up and go, ooh, wow, look at that. Look how messed up this is. Okay, I need to change some dietary practices or put some assistance in to help me digest better. We don't have that ability, though you do have signs and symptoms, right? Your first one is, I'm starting to get heartburn and indigestion, dry mouth. Okay, we got it. All right, already set up. Even, you can put that. Thank you, Dr. Steve. Energy starts going down, brain fog, right? We're falling asleep during the day. Those are all great beginners. Gaining weight, thyroid goes out. Those are all things that say something isn't right in the body, okay? But it started here, okay? There are hereditary factors, but for the most part, unfortunately, we do it to ourselves, okay? And so, let's look at some things that do cause it. These are some big ones that are out there that we're famous for ingesting. Now, this one has been known and is shown and proven to pass the blood-brain barrier, which means they're now finding all kinds of brain tumors, right?
Also the blue one. My daughter had a brain tumor because of the blue one, yes.
Okay.
Is that Splenda, the yellow one?
Splenda, yeah, any of these. So here's the thing about these. These are neuro interrupters. So if we have neurological interruption, is the body able to communicate to say, digestion, I need you to function this way, or there's some type of inflammation in here, I need you to go turn it off? It can't, because it's not signaling right? And the more neuro interruption we have, the more problem that's going to happen down here, okay? So digestion doesn't start here, digestion starts here. And that's one of the big misnomers, is that we think it all's here, and it's not. As soon as you look at your food, your body sends an impulse in nanoseconds. Start releasing this much stomach acid, start releasing this much enzyme, start releasing the amylase, peptidase, all the amylases that are needed to start breaking down your food. And oh, by the way, gallbladder, start releasing bile to break down the fats. Okay, it's here is where it starts. So if it's not communicating correctly, we've got a problem here. Does that make sense? Okay.
Your saliva, right? When you start thinking about it, if somebody says something about lemons, you're like, you know, your salivary starts the breakdown of your carbohydrates, and you're chewing, so you have to chew your food really, really good.
Yeah, it's not just, yes.
Now you had stevia in your hand as well. What are your thoughts on stevia?
Yeah.
Stevia is what color?
The real stevia is black, but they purify it now that it's clear. Most of it.
So they put,
It's a plant.
It's a
And
plant.
it's actually, we can kind of grow it here. It does better in eastern Washington. It's more of a warmer weather plant. And in its natural form, it should be green when they put it into a powder. When it's white, it has now gone through a bleaching process, and they have attached a chemical to it, so it is null and void. And we're now sitting in the same category as the others. Yeah. So, when we look here, some of you have taken my tongue and fingernail analysis classes. So this person, as you can see over in the cavity here, you can already tell that they have something going on in your body. Your mouth is a big indicator that you have illness going on, okay? So this person, if they would have noticed this crack going down their tongue, that's your first indicator that we're not absorbing. It's called malabsorption. And it's usually we're not absorbing minerals when you get that nice crack. And the deeper the crack, the worse it is, okay? So the other thing is when we're looking in the mouth, up on the top where the lip connects to the gum, it's called your frenulum. You can get cysts, and when those cysts are there, they're indicative to polyps going on in the colon. So hands down, they found that one. So the mouth tells us where there's inflammation as well, okay? So when we're looking here, the next one is, of course, Alzheimer's. Now, Alzheimer's is called diabetes 3, but it is a brain on fire, right? It's eating itself. Consumption. That means it is hot and it's like little Pac-Man, and it's just eating and eating and eating away. Now, we have some that have a hereditary factor to it, but for the most part, no. So we know that when we have systemic inflammation, it's going to go up to the brain, and those artificial sweeteners are definitely one of them that's going to head right up here, and it's something that we need to definitely avoid. The other thing that causes this type of brain inflammation is the toxins that we have, the pesticides that have gone onto the foods, the chemicals that they're adding to. Can you go get the Reese's peanut butter cup? The chemicals that they're adding to the foods that you don't know about. And we're very trusting individuals in the United States. We're very, very trusting. And how could we ever believe that they would do something that would harm us? And I didn't think that until I got into this 20 years ago and found out, boy, there's more going on here than what we realize. And unfortunately, they're slipping pesticides into our foods, but not just into our foods, but also into things that you use every day, like your toothpaste and your deodorant and your the stuff you wash your clothes with, and dryer sheets and your mops and your baby's toys. So what I tell my clients to do is to get into the ingredients of the food labels and really read them, and don't take it for granted. And when you get into good old Reese's peanut butter cup, when you get down to the bottom, there's an alphabet called PGPR, and then another alphabet called TBHQ. TBHQ is butane lighter fluid, and they're spraying it on your food. Now, the thing is the FDA has a limitation to how much of this lighter fluid you can have in your system before it becomes toxic. So I want you to think about the holiday coming up, Halloween. Now, how many kids are going to, in the next few days, ingest lighter fluid into toxic levels? The problem is that it causes an inflammatory response of the brain, and it's carcinogenic. Okay, so it's a neurointerrupter, big time, but it also inflames the digestive system, will cause diarrhea and upset stomach, nausea, and vomiting. Okay, if we reach those toxic levels. But we're not reading, we're going after something that's been on the shelves for
We're
long
trusting.
time. We're trusting. This is why would you even think to turn around and read a label on something you've eaten for years? And the only reason I did was because my daughter gave me one last Halloween, and I have what are known as super taste buds. I have more than normal, so I taste things way acutely more than normal. And I said, my goodness, that tastes funny, and I got very worried. It's Halloween. You're supposed to check kids' candy, right? So I'm going, wait a minute, Grace, this doesn't taste right. And she's going, no, Mom, I got this at so-and-so's house, a friend's house, right, when they're trick-or-treating. And give me the label. So I turn it over and I look and I'm going, okay, not only are they spraying this on your candy, but on your cereals and everything else in between. So over-the-counter supplements, etc., which is why we have medical grade, because they're not going to do that to those. So I need you to start reading your ingredients, because this is the things that if you stop and start eliminating out of the diet, you will help take that inflammatory response down.
What
Okay.
was the acronym for that? The
TBHQ.
Isn't it just all, oh my gosh, letters,
Yeah.
just the,
When you start seeing letters and ingredients, put it down, because they're hiding something from you. That's one of the things I learned. I actually have a consumer's dictionary of food preservatives. It's about this thick, so that I can look this up, so that my clients, when I have difficult cases who come in, I'm having to try to figure out why their body's doing what it's doing. I've got to get down to the core of it. And many times it comes down to overindulgence in pesticides they didn't even know about. They had no idea, okay?
It's the toxic load that we're dealing with
Right.
nowadays.
And the thing is the FDA has the set standard, but for whom? Because all of you are different. So their level is for en masse. But the thing is each body is going to digest it differently, and it's going to manage it differently based on their genetics, right, and their digestive system.
So there's a system that brings nutrients into the body, and there's a system that eliminates too.
Mhm.
And so part of the toxic load is not only our own metabolites that we've got to get out, but now we're taking in these other ones that are in the food and in our cleaning agents and our soaps
Febreze and
it's-
all the plug-ins and candles
So what rids the body is liver and large intestine.
and
That-
kidneys.
And kidneys, and they take it out on there. Are you gonna go through the 24-hour?
Yeah, we're getting into methylation real.
Okay.
Okay. So the next thing is, when you're looking at your leaky gut, they say it affects your brain, your skin, your thyroid, your colon, your adrenals, your joints, your sinuses, and your mouth. So in the body, we have a process called methylation. And what it basically comes down to in very simplistic forms is how the body binds toxins and removes them out of the system. There are people who have genetic breaks, and especially in the liver, that it stops them from having the ability to remove toxins properly, okay? And if that happens, we take what we've already put into the system and it's trying to get it out, but it can't. And so then it flushes it back into the system, and then the cells go, what do I do with this toxic mess? And it says, oh, here. And it pushes it into the cells. And our fat cells are what hold these chemicals and these toxins. So a prime example of when you watch the show Biggest Loser and they are huffing and puffing and going crazy, and next thing you know, you see them throwing up, right? What's being released? Toxins. And the body has no other way of doing it but get rid of it. I've got to puke it out. And what they're probably not showing us and telling us is they most likely have diarrhea as well, as the body's trying to rid in all ways through perspiration, vomit, and diarrhea toxins, okay? So if we're storing it and we can't methylate it, move it out, it's another area where it then goes into those joints and has a heyday, okay? The other thing is it opens up the door for bacterial, viral, and fungal issues, and it opens up the door for parasites. And parasites love to eat our joints. They love to eat our heart. They love to eat our brain. They love to eat major organs. And when we're not getting enough stomach acid to start killing them off, then they get to find a happy home in our body. So that also adds to the inflammatory response, which a lot of practitioners don't pay attention to, but one of the things we do pay attention to is, do you have a parasitic load that we need to take a look at to help remove this inflammatory burden, okay? So the other thing we look at is what kind of things can we do to help start putting this fire out. When I have people that come to me and they have a gut overload like that, we call it SIBO, small intestinal bowel overgrowth, candida, etc.
Palpation. People
Yes.
don't realize how painful they are. Remember that they put on the back burner of the brain, that reticular activating system. It's important, it'll come up, but if it's not, it's just going to be put on the back burner. When we get in there and we start palpating on organs, they're like, oh my, wow.
I had
whoa.
no idea.
Yeah, exactly. And so it can take somebody else to kind of get in there and poke and bring it up, and that's when people are like, oh wow, this is something that's serious.
Right. And we just don't know. But one of the things that you can do, I'll put this down and we'll go into that real quick. One of the things you can do when you're eating, if you get onto your rib cages, right on the left side and right on the right side, and right after you've eaten, you get in and you do a nice deep push on both sides. And get a feel, get a pain scale on there. So if that left side is really, really hot and you're really feeling that, that says I need more hydrochloric acid, stomach acid, okay? If it's on the right side, it says, whoa, we don't have enough enzymes to start breaking this down,
That's
okay?
pancreas.
And that's the pancreas, right? So that gives us a beginning of, okay, I'm munching along here and I'm eating and I just, whoop, wow, okay, a little more acid. So you're dining out, what does that mean? Waiter, can I have some lemon? So you can squeeze some fresh lemon into your food. If you're at home, that looks like lemon or lime or apple cider vinegar. And one of the things I find is most people don't use apple cider vinegar correctly. I have people coming to, it's burning. I'm finding out they're drinking the apple cider vinegar straight.
Yeah.
Woo! All to ya. But yeah, that burns. But people do that. When you're working with apple cider vinegar, you take a teacup full of warm water and start with a teaspoonful. You shouldn't ever taste the acid in it. You'll get the hint of the apple cider in there, but we don't ever want it to get to the point of bite. And I have people just gradually add a little more and a little more until just before it hits that sour bite sense, okay? That's when we know we have enough in there. Now here's the deal. If you're on an acid blocker, if you're taking Tums or omeprazole or anything that stops stomach acid, you don't get to add acid in. This nice lining that you have in your stomach, it's equivalent to a cast iron kettle, literally, because you see how hot that is. If that were to leave your body, it would burn up, literally, your intestinal tract. So it is solid in there for a reason, but when you're on a acid blocker for a long period of time, those little wedges go away and it gets nice and smooth as a baby's rear in there, and then you go and put acid on it. Ouch. Ouch, 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 ouch. So people who are on acid blockers don't get to have lemon, lime, and apple cider vinegars, and you'll most likely hear them say, I want ranch dressing because Italian dressing burns up my gut. Okay, I can't eat tomatoes, it kills me. Those are acidic foods. They can't have it because their stomach is already smoothed out. Does that make sense? Okay, so
with the acid being in here, I don't think we said this, but in the duodenum, which is right here, that's where the gallbladder and the pancreas does the enzymes and the fat, and that turns the
Bile.
pH, in the bile, and that turns the pH back up to 7, where it's supposed to be.
the pancreas is dual functioning. It releases enzymes, but it also releases what's called bicarbonate, like baking soda. So it takes that highly acidic acid coming out of the stomach and warms it up really quick so that it can go into the rest of the digestive system without burning it up, okay? So that bicarbonate gets shot out immediately before the food goes in through the rest of, and you'll notice just on that drawing that the coloration of the duodenum, there's a deviation right here where, because this is still thicker than the rest of the small intestine, because it's meant to handle that type of heat until it cools down and then moves into the rest of the digestive system, okay?
So what does drinking soda water do with that process?
Bicarbonate water. So bicarbonate, if it's drank in high consumption, is like drinking pop. It's acidic, right? And it definitely can cause harm to the teeth. But it's also very salty, and you can mess up your electrolytes that way. But it's okay to have every now and then. You bet. I like it, especially in the summer when it's hot. Yeah,
It's all about moderation.
yeah,
It is moderation.
absolutely.
But I mean, like when you have
Oh,
acid stomach or
yeah,
whatever, and
yeah,
you drink
absolutely.
that, and it causes you to burp.
It
what
does.
is it doing?
It does. So what you've done, my mom and my grandma, they all would use baking soda. Now, oh, I've got some heartburn. They go get a teaspoon of baking soda and put it in warm water and drink it down. Kind of along the lines of what Alka-Seltzer does, okay? It's taking what the pancreas does and shooting that bicarbonate. That's what baking soda is, sodium bicarbonate. So you're just adding additional cooling into it to get that fire out, okay? But usually when people are starting to get that acid reflux, it's not because they have too little stomach acid, too much stomach acid, in reverse here, they have too little stomach acid. As we age, starting around age 40, our stomach acid production keeps decreasing. That's why by the time we become seniors, food becomes more and more bland, and sense of smell starts dissipating because we don't have that in us anymore. So we tell people once they hit about 38, 40, when you're having your meals, you need to make sure you get some stomach acids going. And so we take a product called Zypan, because it has a little bit of pancreatic enzyme in it, but it also has some acids in it as well that assist us in breaking our foods down properly.
The sphincter will stay closed until that pH gets down, right?
Or
So-
it's forced open.
Yeah, if you have more food, it's going to force it open. So we want to take right? You don't swim until after you're done digesting. So you got to let it in there for the 45 minutes, an hour, get it enough acid so then it opens and it starts to move through. If it stays in there and you're going hours, what's warm do with a heated, right? Starts to, and then, right?
Yeah, that's where the big one is gas, right? You start getting the toots. And we know that there's not enough acid in your diet when your toots are, the stench is unreal, okay? That's when we know we've got some bad stomach acid going on. If you have the bloating, that tells you enzymes. We aren't getting enough digestive enzymes. So gas and bloating, one is one is the other, okay? But we know also from the belly button up, it's the stomach's issue, and from the belly button down is the pancreas and small intestine issue, okay? All right, so we've got a gut on fire. Inflammatory response, we need to put the fire out, okay? So one of the things we use is RepairVite. This has a double dose of zinc in it, which is hugely healing to the small intestinal tract. So this is one of the things that we use. The other things that we use are dysbiocide, and this is working with people who have a overgrowth of fungus in the gut, candida, chronic yeast infections, chronic scratching in the ears, dry scalp, dandruff. That tells us we have a fungal overgrowth, okay? When we work with butyric acid and L-glutamine, these are natural calmatives to the gut. They feel fantastic when we have people who have a gut on fire. These are things that we use to help everything just calm down and digest better, okay? So many people, because their gut looks like this, I actually have to go in and do everything in liquids because they don't have the ability to absorb, okay? What you cannot absorb when your intestinal tract looks like this. You absolutely cannot. You have to go at it in a liquid form. So I use liquid herbs, and I also have liquid supplements, which is why we brought this line in, because it's easy to absorb and the patient can start healing quickly. And then once we get the fire put out, then we can start moving to supplements, okay? So anytime you're taking supplements and you see them still in your bowel movement, tells you you've got a major digestive issue. If you see unbroken down food in your bowel movement, we have a digestive issue. You are not absorbing. That is a big flag that says, I am not absorbing nutrients. Okay, and that means it's heading out instead of in, and that means it's going to set up that nice inflammatory response that we don't want going into the systemic aspects of the body. So we talked about Tumero, that's a curcumin. Reservo is resveratrol. And then we have methylfolate plus, and I talked about that methylation being able to grab toxins and pull out. Those that have genetic breaks, we actually have supplements that are specific to those breaks so that we can help nutritionally override them so that the body can start functioning like it's supposed to, okay? And then we have enzymes, of course, and of course very strong probiotics, because that's what the gut lives on. Your appendix is not a know-nothing organ. It is actually vital to your immune system, and it helps us with our pre and probiotics. But many people have it removed, and their tonsils removed as well, and adenoids. So we make sure that they're on good gut flora to assist what's been removed from their body. okay? And also after major rounds of antibiotics and like that, we gotta replace what's been stolen from us, okay?
So Lexi,
Yes, ma'am.
with the probiotics, I've been hearing things about a lot of them don't survive the stomach acid, so they don't get into the intestine to be absorbed.
It depends on the brand and it depends on how they're encapsulated. So a good brand, you'll actually see a little bit of sucrose or sugar listed in it, and that's what feeds the probiotic while it's encapsulated, and it keeps it alive until it gets into your body. Being able to bypass stomach acid, yes, they can still bypass stomach acid. It's, to me, it's more of a misnomer, and one more thing that gets thrown out there. But a good quality one, you should see a little bit of sugar listed on there because that's what keeps it alive. Okay? Doesn't matter if it's refrigerated or non-refrigerated. No, it doesn't. There's still quality ones that are sold in the refrigerator, and there's still quality ones that are sold non-refrigerated. Okay? Absolutely. And then some other herbs that we use, gotu kola is used for inflammation, internal inflammation, and also for joint inflammation. So gotu kola is a great herb. Gut flora is one that we use for, again, when we start getting that intestinal overgrowth, Crohn's, etc., where IBS. This has a strong enteric coating, so it will bypass the stomach acid. It will not open until it gets into the small intestine, and then it starts coating from there. So some of these are specifically designed for specific actions.
What was the name of that one?
Gut flora.
I need that.
You need that one? You need that one. Okay. So any questions so far? Doing good?
So I have a question.
You betcha.
So if I've been taking omeprazole for a long time,
Mhm.
are any of the supplements that I'm taking, like I take turmeric and calamag and stuff like that, vitamin D, I'm wondering if anything.
You're not absorbing it. No.
Okay.
Yeah, yes.
I have to go pick up my
Okay.
grandson at soccer practice.
Okay, we'll see ya. See ya, Kathy. So,
Thank you.
that's one of the things that a lot of people don't know. And when you actually read the drug facts, if you go on drugs.com and bring up your drug, and you'll go in and look and see, and you'll be able to see the absorption is not there at all because it's stopping the acid, and the acid is vital for those vitamins and minerals to be bound, encapsulated, and then being able to be carried. So Dr. Steve uses the example of a taxi driver. That acid is in the driver's seat, and then everybody else gets on board so it can be driven into the body. But if we don't have that, it's not going in. And that sets us up, and that's one of the facts on the drug facts is osteoporosis.
So at that website, can they find out what the side effects are?
That's what I'm talking
Those
about.
are
That's the
okay,
side
all right,
effects.
gotcha.
Yeah, you just look up the side effects. But that's number one side effect of being on a acid blocker is bone deterioration because you are not able to absorb vitamin A, vitamin D, calcium, magnesium, anything that's required by acid to be bound and put into the body, and your B vitamins. And it also, unfortunately, sets us up for anemia as well.
So some of that medication is supposed to only be used for a short period of time?
Yeah, there's only omeprazole, any of those acid blockers, the medical trials are only for 6 weeks use. And then if you have not resolved your acid issues within 6 weeks, you're supposed to go back to your doctor, and the doctor's supposed to then go and do further research as to what needs to be done to help you heal. Unfortunately, they've overrode that because I have people that come to me and they've been on it for 18 years, 20 years, and they have no stomach acid.
So what do you do with a person like that? Because I can tell you that if I miss taking that for a day or two, I start to feel heartburn.
Sure.
It's on fire,
So I don't
right?
want to
Right.
not
Because
take
it
it,
keeps
but
it down.
I'm
Right.
thinking I better not take it.
No,
So what do I
you
do?
never ever just
Yeah.
stop.
Right.
We
right.
work on, we use different supplements that I didn't bring out that are used to assist the body in starting to put the acids back in again, and we gradually titrate off of those blockers so that you can start producing acid again. but it's a slow process. We don't do it quickly at all. The body really has to get used to it. And for people like that, I actually tell them to do something that is unheard of, and that's eating standing up.
Oh.
Because the food comes down. When we sit, we tend to slouch, and that puts everything down. So I have everybody that has that type of issue stand up and eat standing up, and then walk around. Don't go sit down, and then once they feel like everything feels okay, and we eat more frequently throughout the day, smaller meals, so that it's easier to digest, but standing up. Yeah, it's a little different, but it works. Works good. Yeah.
I just want to mention something that I just find so crazy. My sister recently had a stroke, okay, and she was in the hospital, and of course eating hospital food, and she told them she was used to taking a calcium supplement, and they brought her Tums to take.
Yes. They're giving pregnant mamas Tums too.
Oh my goodness.
Isn't that wonderful? Just go, I remember when I was pregnant with our first one, that was the number one thing in our prenatal class. I need you to make sure that you're taking at least 4 to 6 Tums a day.
Oh,
So let's take something to stop you from blocking calcium, even though your baby, by the time you're 9 months along, is going to be stealing over 2,000 milligrams from you out of your bones every day. Yeah, so.
That was in addition to your prenatal vitamins?
Yeah, take your prenates and your Tums.
You were talking about, if I can share this,
Mm-hmm.
the toxicity of a lot of our cleaning supplies. One of those little blurps on Facebook said to use Bounce dryer sheets.
yeah.
If you put them, if you have spiders and bugs and stuff coming in your house, to put those in your windowsill. I thought, if they're killing the bugs, and I put them on my clothes.
Nice job, Mark.
I mean, now, we did put some in our trailer when we stored it for the winter, but, you know, I thought,
The doctors in Mexico, I have had several clients that have left the states to go have treatments done out of state, medical tourism, but it's the term for it. The doctors in Mexico are telling the female patients, if you're using dryer sheets, get rid of them because they cause cancer.
Ooh, yeah. Well, I don't use them. But by the way, for bugs, if you'll just take a little cotton ball saturated with peppermint oil,
yeah.
they'll
yeah.
flee.
Yeah.
They'll flee. They don't like them.
Well, you know
Little
why the
different.
Europeans put geraniums in their windows? It's not to make them pretty, it's because it keeps the flies out of their house.
Isn't
And we
that
did
great?
that this summer, right by our sliding glass door. We had a whole bunch of geraniums and we didn't have any flies.
There you go. Perfect. Okay.
Wonderful.
So that gives you a nice kind of introductory level on inflammatory response, where it starts, how it can perpetuate and get worse, and what we can do to definitely modulate this way. Of course, diet is another one. And we have to look at what we eat and how we eat it, because what we're eating is what we are. Our food is our body's fuel. So we have to remember, if we're fueling our body with things that cause an inflammatory response, that's not helping it either. So we have to watch, okay, am I eating what I tell my clients, raw and real? Is it still alive? Was it alive not too long ago, right? Can you easily digest it and get it down? Because things like canola oil and soybean oil, no, you can't, because they're pesticides. They're not oils, they're pesticides. And we cannot digest pesticides. So we go into those natural oils like coconut oil and butter, like we talked about, ghee, avocado oil, etc. Those are good oils that we want to be consuming and cooking with. We want to make sure that we're keeping things like burgers and fries and pizzas as treats every once in a while, even though they are a quick and easy food. Unfortunately, they're full of things that will cause that, especially any type of dried cured meats, make more of an inflammatory response. So we want to make sure we're putting the fire out, okay, not adding to it.
I think it was great what you talked about with digestion and such like that. What about like a cleanse to open up so that we can get rid of right?
Right.
Because our body stores in the 24 hours, if it can't get rid of it, it puts it in the fat cells. So we don't want that, we want it to get out. So
Right.
what is,
It depends on the health of the person. I never just jump people on cleanses. I find that to be quite dangerous. We do run a cleanse here, and there's only, I used to run it as classes, and we put everybody on it, and everybody got to suffer through. And there's others that suffered way more than others, because that showed you how gunked up and inflamed their system was, right? So cleanses are reserved for when your body's actually ready. And when I work with my clients, I determine that. If they say, you know, I feel like I want to do a cleanse, I just want to get up and through this and get over it, great, then let's do it. And then I'm monitoring them and assisting them through it, because some people go through some really big detox issues. But the other one is at the same time they end up killing parasites that they didn't know they had in them. And the die-off from that is awful. It's called an aflatoxin. And aflatoxins are dangerous, really dangerous to our body. So we want to be careful about how we cleanse. If we're healthy, great, go for it. Every 6 months, go ahead and put a cleanse in. But if we're new to it and our body we know has gone through the ringer, we don't just jump on a cleanse. We go easy with it. So that's why we do like the clean eating challenge, because that's an easy way to not harm the body and can go step by step and day by day into it, not just, okay? Not good.
so the cleanse or the clean eating challenge, we're just we're eating real and raw,
Yeah,
and we're keeping out toxic load,
right.
right? So that we can reset and calm things down and get them to function like they're supposed
Right.
to.
Right, absolutely.
I know you've mentioned butter. What are your thoughts? And I can't remember, and I apologize when you were talking about your 30-day challenge, you know, obviously getting out your glutens and things like that. I didn't hear if you said dairy.
What I do is I reserve dairy. They can be on dairy, and if they still talk to me, because I have them fill out a symptom form when they start, and I go through that form. And we do weekly check-ins, and by week 2, if they're still at an inflammatory state, then we remove dairy. But I don't remove it from the get-go, because they're already going off of sugar, all grains, coffee, tea, everything else. So I reserve some things that allow them to still have some treat, but if we're still responding, then it gets pulled
For
too.
me, it was the sugar that was the hardest to get off.
Yeah,
It is.
yeah, absolutely.
Is liquid stevia any better than the powdered stevia, or is it all not so good?
You can go over to Fred Meyer's in their bulk food section or the food co-op, and they have green stevia. It's in the bulk, and you can just get it and add it to your drinks and all that.
So what is the form? Because I've only known it in the little packets or in the liquid. So
It's a powder,
it's a powder.
and
okay.
and it's from a ground up plant.
Oh, okay.
That's why it's
Okay.
green. Yeah.
Okay.
Lexi, let me just say, the reason I said it should be black, the first stevia I ever tasted was years ago. I didn't even know what it was. I was at this lady's house, but she was into herbs,
Right.
and she gave me some tea and brought this little bottle of stevia, but it was black,
Okay.
but it was from South America where
I was
this
to say,
plant
where
grows.
was it from, Sandra?
South America, South America.
Yeah.
Yeah, because that's where the plant, I guess,
Right.
grows, you know?
But when over here in the States, it's green.
Oh, okay.
So it just depends on the origin that you're getting it from.
Okay.
Okay?
So
But yeah.
black wasn't necessarily bad. It
No.
was just,
No, it's
Okay.
just where you're getting it
but
from.
it probably wasn't purified like
Right.
this white stuff. Okay.
So yes, I agree in doing cleanses and getting things opened up, but at the right time. Not just jumping. Don't ever just jump on a cleanse. What happens is many people will get going and they'll get toxins starting to release, and like I said, they get that die-off effect. They don't like what's happening and how they feel, and then they hurry up and quit. And then everything that was working its way out gets shoved right back up, and then we're really, really sick. Okay, so I'm cautious with cleanses. They need to be,
It's a process.
yeah, it's on an individual basis.
Gotcha.
Yeah, but I totally agree with doing it, because we do it.
Yep.
We do it, so, but it's as needed. All right,
So you didn't talk about this hand that's terribly
That's the
deformed.
arthritis. That's
Oh.
arthritis. So remember,
Oh.
once it's gone systemic, it goes into the joint, and that is severe acute arthritis, right? So if one of the things we've got to watch with being on acid blockers is that sets us up for arthritis because we're not getting calcium into the joints. It stops the fluids, everything. So we want to make sure that, again, those oils that we talked about, they're going into the system. We want to make sure that we're getting good vitamin D going in Washington. The doctors are, when I have most people come in, my doctor says I need 800 milligrams. And in the holistic industry, we say around 2,500 and up. If you have a genetic break in VDR, which your body doesn't absorb properly, vitamin D, we have them up to 25,000 units per day to override that genetic break. So it just depends on the person, but starting at 2,500, by about December, November, you should be sitting up around 5,000 to 6,000 units because we're pretty dark by then.
I have a break,
You have a genetic break.
and we found that out, and it was like, oh wow, what a difference on there.
Mhm.
So I'm on that higher level now.
Yeah, he's on a much higher level than I am.
Can I say one more thing? With my first child, my mother had just read the book by Adele Davis. This was when vitamins were first coming
Right.
in. And in that book, she claims that vitamin D is a great pain reliever.
It is.
And so when I was in labor with Tanya, you know my daughter Tanya, I was munching on these huge wafers of vitamin D with calcium the whole time. And,
Go girl.
and I almost had that baby by myself.
I bet.
Oh dear.
So, you know, it works.
Go girl, go girl. Absolutely. So higher levels of vitamin D starting up about next month and riding through about March, and then you can start bringing it down again. Calcium, depending on your age, should be anywhere from 1,500 to 2,500 milligrams, and depending on if you're osteopenia or porosis, that can go higher as well. Always take your vitamin D and your calcium with an acid, and it'll drive it in, right? Yeah, help that acid go in.
So when are you gonna start your next cleanse group?
That will be January, and I don't have it on the calendar yet because I haven't seen the 2016 calendar, but we'll be posting it around the office and throwing it up on the website and on the Facebook pages as well, so that you'll
What's your website?
is www.championchiropracticcenter.com. Not too hard. Any other questions?
Can you tell me what's I drink coffee like one a day.
Mm-hmm.
Like, what is the problem with coffee? I mean, you know, like you were,
Right.
I just don't understand.
That
So what
is a good question, and it's also for our Are You Tired class.
Oh.
Okay, because we're going to be discussing how it affects the feedback loop of blood sugar.
Oh.
It directly affects blood sugar.
I wanted to kind of name the class, what can we do naturally other than coffee? Okay? People use that a lot. And, it's that moderation and
Right.
knowing and understanding. I was in the thinking that it didn't do anything. Well, now I have more information.
Yeah.
We'll share that.
We're going to be sharing that because that's a whole nother lecture.
Oh, I see.
That's a
Okay.
whole other lecture, yeah.
Okay.
Yeah,
I'll see
so
you there.
come learn. So that we'll be able to discuss that further. Is coffee bad for you? No, it's never been proven to cause health like cancer. They keep saying cancer. Okay, no, there are way worse things that cause cancer.
Yeah.
Okay, way worse things that we don't need to be getting into our system. Coffee's been around for centuries, okay? But what it does do is it starts messing with feedback loops, and that's where the body starts deteriorating and we end up with some big problems. Okay.
Okay.
So that's where coffee's great, but let's be careful with how we use it.
But it's actually the caffeine in the coffee.
Yes. absolutely.
Because the medical profession is now saying because the coffee is an antioxidant, it's actually,
Absolutely.
Yes,
That's good
they
for you and all that good stuff.
you know.
So does it break down the system and harm it? Depending on how you use it.
Not good for acid reflux, is it?
Oh no, makes it worse. Yeah, not good for acid reflux. That's unfortunately one of the things we have to remove for people who have that.
Well, great. Hopefully this was great information for you tonight.
Yeah,
and,
big